So if you do end up coming to physical therapy for a balance issue, what we will start with, your first visit, will be a full and thorough examination. There will be an inner portion of the evaluation where we talk about things like your past medical history. Were you diagnosed with any of those conditions mentioned previously? And how are we going to incorporate our program to limit the effects of those types of medical history complications? We are going to talk a little bit about your current activity level, as well as what are your biggest complaints. What activities do you want to get back to? Do you want to get back to playing tennis? Or do you simply want to get back to making it easier to walk around your house or walk around the store? Do you want to be more comfortable going up and down stairs? These are all things that we will tailor our program specifically towards your goals to improve your safety and get you back to doing what you want to do. Once we're done the interview portion, we will then move on to some testing. So, as I've said previously, strength and range of motion, two big things that play a factor in your balance. Some tests that we can do to get some baseline measurements of your strength. Make sure that your joints are properly moving so that you have the ability to maintain your balance. We'll also look at a couple of specific balance functions. So we have a couple of cool things in this office. Our BioSway is up here. So it's set up a little bit differently right now, but there's a plate that you stand on that can actually detect how your weight is shifting in your feet under different circumstances. Your eyes are closed. There's a foam pad put on it. So this can give us objective data of how your body is able to react under different conditions. And then we can move on from there if we're seeing that your data compared to a normative data is putting you at a higher risk for falls. And then lastly, looking at some functional things, looking at your walking speed, looking at your gait pattern itself. Are you somebody who takes small steps to get around? Are you somebody who has to step out to the side? Things like that can give us ideas if there's unsteadiness in your gait pattern. That's going to then again place you at that higher risk for falls. Things like taking turns, things like going up and down curbs or stairs, and then ultimately the sit-to-stands are a great functional test to see the strength of those legs. As I've been saying, physical therapy will create a program specifically tailored for your needs. So it might include a variety of the types of activities that I have on the screen here for you. A mixture of strengthening, a mixture of stretching, a mixture of some postural awareness things to improve your body's response, to know where it is in space, to know if you're on an unsteady surface that your body is still able to maintain that upright position. Things like visual tracking. If your eyes are giving you poor feedback about where you are in space, that's going to make balance more difficult for you. If we do some tests and see that it is due to an inner ear problem, there's different maneuvers that we can do that's going to decrease that dizziness and that sensation of room spinning, which is going to make you more difficult when you're in that upright position and trying to walk throughout your house. And lastly, there's some at-home modifications that we can go over that will be mentioned later in the slide presentation about how to make your home the safest environment for you. Ultimately, our goal in physical therapy is to increase your confidence, or in turn decrease your risk of falling and increase your activity level, getting you back to doing all the things that you want to do safely.